coronavirus. What are your concerns or your fears? Tonight, it's all about you, as this next part will be led by the questions you wanted medical experts to answer. Joining me in this conversation is Dr. Mercy Mwangangi, who is the Chief Administrative Secretary, Ministry of Health, and she's the only lady in this panel. Thank you for joining us tonight. We have two professors and two doctors, and I'll start with Omu Anzala, who is a professor of virology and immunology, Kavi Institute of Clinical Research, University of Nairobi. The next professor is Rodney Adam, an infectious disease specialist from the Aga Khan University Hospital. Last but not least, I'm also joined by Dr. Paul Younger, who is a medical doctor with clinical training in infectious diseases, HIV medicine and public health, a travel medicine specialist. He has a lot of titles, this doctor. Gentlemen and lady, thank you so much for joining us tonight. Like I mentioned earlier, this segment will be driven by the audience. I have a few questions that I'm going to throw at you, but feel free to answer them. The first question perhaps I'll ask is concerning today's press briefing by the Health CS, and I think I'll direct this question to Mercy, Dr. Mercy. A lot of people have been asking this question about the cases that have been coming in, and the CS said that all the cases, all the coronavirus cases are imported, and the people are saying that the airport should have been closed a long time ago because all this came through JKIA. Do you think closing them this coming week on Wednesday, stopping all international flights apart from the cargo flights, is a little too late?
So, Dennis, the CS was clear today that we all need to be alert. We need to scale up our response to this virus. And indeed, we truly believe that the measures that were given out today, the directives that were given out today on ensuring that all international flights are banned coming Wednesday will help us in this fight. The Ministry of Health has been emphasizing through guidance from WHO that we have to ensure we social distance. And in social distancing, we will be able to flatten the curve. So we truly believe that the measures put in place today will go a long way in aiding this fight. As the CS reiterated, we need to brace for the worst. This is the week within which we have to escalate our interventions.
Well, thank you, Dr. I think I can throw this to any of the gentlemen on the panel. Do you think this is coming in a little too late? We have all the cases which are imported coming through JKIA when there were calls to stop international flights a long time ago.
Well, I think so far with regards to scaling up of interventions, you normally want to start very low. When the CS initially talked about the issue of social distancing, I do agree with Madam CS that of course, at some point, you really want to make sure that as you're implementing your social distancing, you don't want to be as strict as would be anticipated. But as you start seeing a growing in the number of cases, then that's where you also want to titrate your interventions upwards so that you make sure that you don't experience an upsurge, especially in the number of imported cases, so that you have actually a bit of time to deal with the cases that are within the country.
Well, Professor Anzala, what do you think?
Yeah, I don't think it's late because within the very first week, when the first few cases were announced, we actually put in measures immediately to begin social distancing. Really what we ought to be doing is that these measures must be observed. That is actually the critical thing. So today was an issue of now escalating, and today was also an issue of ensuring that those who begin to violate those measures, something is actually done. So as far as I'm concerned, it's not too late.
It's not too late?
Yes.
Do you agree with that, Professor Rodney Adam?
Yes, and I'd like to emphasize that those decisions are really difficult decisions because when you put restrictions into place, you're also affecting people's livelihood out there. So if you're too strict, then you have a problem. If you're not strict enough, then you have a problem. And we've never been this direction before. So I think those decisions are very difficult, and I have to admire the ministry for the way they're handling it.
Well, without any further ado, I want us to jump in straight to the videos from our audience, and I'll start with the first video, and it's about salty water. Let's listen in.
Okay, there's a rumor spreading about the COVID-19, which I don't know whether it's true or not true. that before the incubation period ends, which is 14 days, in the first 4 days when you have detected that maybe you have the disease, when you take salty water, it will kill the virus which is still staying on your throat. That the virus is still not yet in your lungs, but is still on your throat. So I don't know whether it's true that the virus is still on your throat and you can save yourself.
Dr. Mercy Mugangi, I'll throw this at you.
Right, so that's incorrect. So we've had many rumors in social media. Salt water will not kill the virus. Vinegar will not kill the virus. Concoctions of garlic and ginger will not kill the virus. In terms of how this virus behaves and how it attacks the body, there is no evidence right now that's able to tell us that the virus stays in the throat and then goes into the lungs. It's a new disease. The scientists are working on it. But all the myths that are treading in terms of if I take alcohol, if I take changa, if I take vinegar, all those are false.
So this is the point where we separate the myths from the facts. And I want us to go to the next video. And it's about something totally different. It's about alcohol.
Maybe just to add to what Marcia said.
Yes, Professor.
I think the understanding should be that when the virus lands on the mucosal surfaces in the throat, it's not that it stays there. Viruses infect very, very quickly. They bind onto the cells on the surface and immediately penetrate those cells, and the infection actually begins. So it is a myth to think that the virus is sitting around on the surfaces for a long period of time. They are already inside, and the replication period begins. And that's why we talk of a period of about 7 to 8 days. And this period of time, the virus is already replicating in the cells before the one begins to get sick.
So gargling salty water does not help. Very, very clear. Let's go to this next one, and it's about alcohol.
Can consumption of alcohol make someone self-defended or secure from catching corona? Because we understand most of the sanitizers are having 70%.
Well, this I think I'll throw it to Professor Rodney Adam. Interesting.
No, drinking alcohol will not help. In fact, it lowers inhibitions and it might keep you from practicing proper hand hygiene, social distancing, etc. So alcohol has nothing to offer good and potentially bad.
Well, that's just straightforward. There's another one here, and it's all about what are the other symptoms, apart from everything else that we are talking about, the coronavirus.
Apart from sneezing and coughing, what are other symptoms of coronavirus?
Well, I think I can let Dr. Paul Young answer this. What are the other symptoms? We're talking about sneezing and coughing and everywhere, including our office here. When someone sneezes or coughs, everybody stamps, everybody wants to run away. What are the other symptoms?
Yeah, so in a majority of patients, actually what they experience mostly is really extreme hotness of the body. That's fevers. And then they also present with a dry cough. And most of them as well also present with a sore throat, really, and muscle pains. Most of them really come in with, I must say, much more aggressive symptoms of what would take as a common cold. And that will take place in more than about 80 to 85% of patients. Then when you get to the 10% spectrum, they may present with a bit more difficulty in breathing, what we call dyspnea. And then in another 5% of patients, they now present with a typical symptoms such as nausea, vomiting, and diarrhea. In a couple of them now, that's where you now experience issues such as reduced micturition or reduction in your volume of urine, and also an increase in your heart rate. That's really the most severe part of the disease spectrum. But in the majority of patients, they mostly present with extreme hotness of the body, a dry cough, and really muscle pains generally.
I mean, Professor Omonzala, just understanding the behavior of viruses, like you earlier alluded to, the difference between the viruses and the bacteria. For this one, what else should Kenyans look out for the feelings in their bodies, because some people start feeling a headache just right here, others is anywhere within their temples, others is just having, a stomachache. What are the other symptoms that Dr. Younger maybe perhaps has not mentioned?
I think one of the things that we are now beginning to gather is also something to do with sense of smell. There are those who will begin to report quite early that they are losing sense of smell. And that is because of heavy infection within the upper respiratory tract. But the whole issue about how viruses behave is that viruses, unlike bacteria, normally get inside the cell. And once they are inside the cell, the replication is so fast. And all this symptomatology you are hearing being explained here is because of that rapid replication, then the immune system also responds very, very rapidly, and hence the fever, the feeling fatigue, and all these other signs that we are talking about. It is because of that rapid nature. And this virus has also been associated with a very heavy viral load. There's so much of it in the throat and in the respiratory tract.
Dr. Masi, I think you have something to add there, Ronnie, before I ask Dr. Masi a question.
Yes, and just a couple things to emphasize. This is a lower respiratory virus, not an upper respiratory virus. So the cough is a deep cough from the chest, and interestingly, runny nose is really not part of this. That's fairly rare. And that's worth knowing because of the panic that people have when they have any kind of respiratory illness.
Dr. Mongangi, I'm not sure whether you've interacted with, the patients or heard from their families, but the symptoms we are talking about, are they the same symptoms that you're hearing from the patients who are at Kenyatta and also at Mbagathi?
So yes, Dennis, as the professor and the infectious disease doctors have told us, Dr. Younger as well, the patients that we have in isolation, the ones who've been confirmed positive, are presenting with these symptoms. But it's important to note that so far, save for the one patient that the CS talked of today, all our patients are more or less stable and are those that are experiencing mild to moderate symptoms. The one patient that we have who is currently being evacuated to Nairobi may be landing in terms of the severe critical band. Yeah.
Well, thank you, Dr. Masi. There's also this other question, and there was this whole debate from what Donald Trump, who's the US president, said. And the question is concerning chloroquine and malaria drugs, and there's also talk of HIV drugs, the ARVs. Let's listen into this question concerning malaria drugs.
We have been told the malaria drugs can cure the virus. Why are we then not just making people to live and make sure the high production of the drugs so that people can be cured of the disease? Thank you.
Professor Rodney, what do you think?
Yes. Well, first of all, we don't really have good data on whether chloroquine or its relative hydroxychloroquine work or not. Secondly, if they do work, it's not because of effect on the virus. It would have to be related to an effect on the immune response. There are some drug trials that are out there. We already have evidence that the HIV drugs, at least the ones called protease inhibitors, don't work. There are other drugs being tested right now, and we're all very anxious to see if any of those will change the course of illness.
Well, we saw a lot of patients in Nigeria who had overdosed on this, taken to hospital. And there was also a situation in China where volunteers were also sharing ARV medicines. Dr. Younger, do you believe there's an ounce of truth in any of this? Does this really work?
Yes, so just as Professor Adam has just mentioned, I think it was just early this week where we just saw the publication whereby the protease inhibitors, that is the anti-HIV drugs, don't seem to be effective in management of these patients. Drugs like hydroxychloroquine, a lot of the data that we are seeing is quite anecdotal. It's not been properly studied in clinical trials. So it's something that we may not seem to suggest with very hard evidence. So it's really, these are drugs that are being administered, I must say, in a very experimental kind of way. The effect can only be properly examined when properly done and ethically approved clinical trials are actually done. So As we speak right now, it's really more anecdotal, more of just reports, but they should be properly validated in clinical trials.
Well, those are just myths. Professor Anzala?
Yeah, but just to add that I think WHO thinks of putting together a well-controlled clinical trial to just look at chloroquine, hydroxychloroquine, and azithromycin, and also to look at an HIV drug called Kaletra. So what we are saying is that through those clinical trials, then we shall actually know. But other than maybe Kaletra, which is an antiretroviral drugs, these other drugs will actually be aimed at the immune system and not at the virus itself. So clinical trials are being put into question, and then eventually these drugs are being put into question, and hence the planning of the well-organized randomized clinical trials.
Well, on that note, very quickly, Dr. Massey, we know, like the professor is saying, there are clinical trials. We don't have a vaccine yet, but at the ministry, are there medicines that you're looking at that perhaps could, work perhaps?
So just as Prof. Anzala has mentioned, there are trials that are underway. WHO will be organizing a trial, and it's important to emphasize that when you as a doctor prescribe a drug, there's a protocol through which the drug has to go through so that we can say that this drug will be useful and this drug will be able to manage the patient. And so far, all the drugs that you've heard of, so the chloroquine drugs, the Kaletra, I've had different people talk about azithromycin, all these drugs will be studied and trials done. It's important to emphasize to Kenyans that we've received reports that people are trying to source for these drugs in the facilities and in the chemists. And we're kindly urging Kenyans that, one, do not take chloroquine and think that it will protect you. The science right now does not prove that, and we are working to see, and under the guidance of WHO and different other bodies, to find out which drugs would be useful. So right now, we are really discouraging Kenyans from going into the chemist trying to source these drugs. We're discouraging Kenyans from trying to source HIV drugs or share HIV patient drugs.
Well, very many thanks, Dr. Massey. Well, the conversation continues here on NTV Weekend Edition. Remember, the hashtag to follow is the COVID-19 pandemic. That's the hashtag. You can also tweet your questions, send them on Facebook as well at NTV Kenya. We'll be able